Thank you, Patty. Every day we see patients who complain of trouble sleeping. So Dr. Brossfield has some tips that will help us all get a good night's sleep.
Absolutely. Every adult should get between 7 and 9 hours of sleep a night, but at least 60% of women fall short of this goal, and that begins to accumulate sleep debt. Over time, sleep debt increases and causes risks to our health, such as heart disease, stroke, and diabetes. What can you do to get a good night's sleep? Start with clearing of your mind. If there are things you need to get off your plate, so to speak, go ahead and do it before you try to go to bed. Secondly, create a sleep haven. You want to make a space that is comfortable and restful without the intrusions of technology, television, your BlackBerry, and make it a place that you preserve just for sleep and intimacy. Secondly, make sure that you nap as little as possible. If you've lost significant amounts of sleep because of working a night or having an unusual event, go ahead and take a 1 to 2 hour nap. But in general, regular napping may rob you of good sleep during the night. Also, avoid caffeine and chocolate after about 2 p.m. Those substances can stay in your system for at least 7 hours and may make you alert for up to 20 hours. As well, one should exercise regularly because it does promote good sleep. However, try and cease your exercise at least 3 hours prior to going to bed, and it will promote a good night's rest. In addition, protein meals are wonderful throughout the day. However, if you eat your large protein at night, you may inadvertently make yourself stay awake because protein causes a person to be more alert. Higher carbohydrate meals will help you rest. And it turns out Mom was right. A glass of warm milk, a warm bath may promote you getting to sleep much more easily, and that's a healthy habit.
Back to you, Patty.
We're going to go to our two wonderful, beautiful ladies from Rancho Mirage Women's Health Center, Dr. Lisa Lindley and Dr. Jeralyn Brossfield with a Medical Minute. What's going on, girls?
Thank you, Patty. I'm Dr. Lisa Lindley.
And I'm Dr. Jeralyn Brossfield. Today we're talking about the keys to cancer prevention.
That's right. In November of 2007, the American Institute of Cancer Research announced the results of its 5-year panel, which analyzed over 7,000 studies to present its 10 recommendations for cancer prevention. The recommendations focused on managing appropriate weight, diet, and exercise. And the recommendations are as follows. Number 1, be as lean as possible within your normal body weight. Number 2, be physically active every day. Number 3, limit consumption of energy-dense foods, which they define as high-fat foods, desserts. Number 4, increase consumption of fruits and vegetables. Number 5, limit consumption of red meat and processed meats. Number 6, limit alcohol consumption, which they define as 2 drinks a day for men and 1 a day for women. Number 7, limit salt intake. Number 8 was to meet your nutritional needs through diet as opposed to supplements. Number 9 stated that women should breastfeed their infants. And number 10, that cancer survivors should also follow these recommendations. Now, as you can see, these are all very basic recommendations that we've heard before. But they stated if these 10 recommendations were followed, cancer rates would decrease by 30%. If not smoking is added to the list, cancer risks decrease by more than 50%. In this day and age, when everyone is searching for the magic cure and the fountain of youth, the simplicity of these results is impressive. So this is a challenge to all of us, to begin with these simple diet changes and to find an exercise routine that we can incorporate into our daily lives, because that is a very healthy habit. And back to you, Patty.
Welcome back. Continuing our healthy show, we have some great tips from Dr. Lisa Lindley and Dr. Jeralyn Brossfield, our partners over at Rancho Mirage Women's Health Center, with a Medical Minute. What's up, girls?
Thank you, Patty. I'm Dr. Jeralyn Brossfield.
And I'm Dr. Lisa Lindley. And today we're talking about osteoporosis.
Osteoporosis, which means porous bones, is a disease that weakens our bones and makes us more likely to have a bone fracture. Approximately 50% of women will have a fracture of their bone after the age of 50 because of bone loss. Throughout our lives, our bodies are constantly in a process of bone remodeling. We break down old bone and rebuild with new, stronger bone. And in fact, up till the age of 30, when we reach the peak bone mass, we're constantly building more than we're breaking down our bone. Between the ages of 30 and 50, we start to slowly break down more bone than we build up. And many women develop what's called osteopenia, or a borderline zone of bone loss. After the age of 50, when menopause occurs, there's a diminishing of the estrogen, which has bone protective effects, and many women have rapid bone loss. In fact, 20% of bone is lost in most women within the first 5 years after menopause. So what can you do to prevent this? The Osteoporosis Foundation has 5 recommendations for maintaining your bone strength. The first is to take in the adequate amount of calcium and vitamin D every day. That's 1,200 milligrams of calcium and 800 international units of vitamin D on a daily basis. Also, get regular muscle strengthening and weight-bearing exercise. Third, avoid excess alcohol and smoking, as these break bone down. Fourth, talk with your healthcare provider about maintaining bone strength. And fifth, ask for a bone density scan called a DEXA, as that will help determine where you are in this process. So take action. You can be proactive and have strong bone. It's a healthy habit.